to reduce pain and inflammation. We're going to break it down. Before we dive in, please smash that like button. Put your comments down below. Let me know the supplements that have helped you the best. We'll kind of dive in. So, first off, what is inflammation? So, in the body, we have anabolic metabolism and catabolic metabolism. Anabolic is your body's building back up. Think of anabolic steroids like testosterone and growth hormone. They build your body back up. And then we have catabolic, right? Levels of building, which is your body's breaking down. All right. It's breaking down faster than it's building up. Think of lots of exercise and getting really sore, overly sore, where you have a hard time walking in the next few days, right? Think of that kind of catabolic breakdown. So when you're chronically inflamed, that catabolic metabolism is overwhelming the anabolic. Your body's breaking down faster than it's building up. So typically we have homeostasis, catabolic, anabolic is good. That's a good thing, right? With lots of different things, because you want to break down a little bit, build back up. So you're tearing down that old scaffolding, building back up stronger. And when you're breaking down more than you're building back, that's where inflammation comes in. And of course, there's a lot of chemical messengers involved in inflammation that tend to be, let's just say, higher than normal, out of range, maybe even out of control, especially when we're dealing with certain autoimmune conditions that are inflammatory in nature, like rheumatoid arthritis, polymyalgia rheumatica. You could think of other inflammatory issues with the intestinal tract, like IBD, like Crohn's, ulcerative colitis. Okay. Any of these kinds of conditions could fall into that category. So we may see certain things like interleukins, interleukin 6, 1, 2, 3, different cytokines, nuclear factor kappa beta. You may see different compounds like C-reactive protein elevated. You may even see ANA, anti-nuclear antibodies elevated, part of an autoimmune cascade. You may see SED rate, erythrocyte sedimentation rate. These are all markers of inflammation. So the broader ones are going to be more CRP and SED rate. And then you can have some homocysteines, another inflammatory metabolite due to an insufficiency of B vitamins and or just not getting too many crappy B vitamins from junky foods like sodas and breads. And so when we look at that, we can run a test and look at interleukins and cytokines and different imbalances in these inflammatory markers. A lot of times you don't have to, because you just know the person's in pain. They don't feel good. They may have a known autoimmune condition. We may be looking at just broad inflammatory markers like CRP or SED rate. These can be good things to look at. We may see a lot of increase in clotting, inflammation in the vasculature. We may see the homocysteine or fibrinogen or D-dimer elevated. These are all possibilities, right? So we got to look deep at what the root cause is. And so the first thing is, before we talk about supplements, a lot of good supplements that help modulate a lot of these inflammatory markers. The question you have to ask yourself is, are we getting to the root cause? That's really important. Now, sometimes the root cause is an autoimmune condition. And so are you getting to the root cause of that? Maybe not. So some of the big triggers of autoimmunity, of course, are going to be food, right? Gluten, food allergens, dairy, refined sugars, carbohydrates, flours, excess omega-6 vegetable oils, more pasture-fed, not pasture-fed, but more feedlot animal products where animals are fed lots of antibiotics and soy and junky fats. So really important, you got to look at the foods. Say, what are the foods that are driving that? Do you have gut permeability issues outside of just from the food? Do you have gut permeability issues from poor digestion, from bacterial overgrowth, from infections, H. pylori, parasites, yeast? Are you so stressed where your hormonal system is very depleted and you don't have enough cortisol or thyroid hormone, or your female hormones are depleted, or your male hormones are depleted? You don't have enough hormone support to help your body heal and recover and build back up, right? Trying to think, do you have so much toxicity going in your body that your body is so depleted of its sulfur and glutathione resources that it has a hard time taking those toxins out? And those toxins are keeping the body inflamed, whether it's mycotoxins, mold, pesticides, chemicals in water, right? So the first thing I look at is you have to kind of make a mental note of what the root cause is, okay? And it's okay if you're not going to get to the root cause right away, but at least make a mental note of it, because I always say, okay, is this palliative? Meaning just so you feel better in the moment, or is it palliative and root cause? We always want to keep the root cause in the back of our head. And then, of course, when we look at other things, too much exercise can be another thing that drives inflammation. Not enough sleep, not enough recovery, lots of emotional stress, all those things. Anytime your stress bucket fills up, think of that as your inflammation bucket. The more inflammation inputs you put in, the more that bucket goes up, the less ability you're going to have to adapt. Okay. So now we talk about some of the nutrients to help with reducing inflammation. So, of course, diet and blood sugar and all those inflammatory foods, that makes a big difference. On the other side of that is omega-3 fatty acids are very helpful. Omega-3 fatty acids help inhibit the prostaglandin E2 pathways that you'll see a lot of junky omega-6 vegetable and seed oils go down. You'll see some non-high quality animal products go down some of those pathways too. Again, grass-fed, pasture-fed, different fatty acid ratio, a lot more anti-inflammatory. So again, fish oil can be very helpful at reducing that prostaglandin E2 or the eicosanoid E2. Very helpful there. Next would be curcumin. Curcumin's awesome, right? It's an extract from turmeric, very helpful, not absorbed that well. So you want to take it in a liposomal form to really maximize the absorption. You can also take it with black pepper, it does help, but a liposomal curcumin, very helpful. In my line, we use one called Curcumin Supreme, mixed with a little bit of a sunflower lecithin, which is helpful, just very tiny bit, just to help as a carrier to get it in there to increase the absorption. Curcumin, all kinds of benefits from modulating interleukins, cytokines, definitely helps knock down and decrease nuclear factor kappa beta, definitely helps modulate the immune system as well, Th1, Th2, be very helpful with that as well. So love curcumin, excellent. Next, I would say would be frankincense or Boswellia. Boswellia serrata, frankincense, basically the same thing. Frankincense, you typically see it in the essential oil form, which could be great topically to rub on like your tennis elbow or something. Or you take it, the herb, which is Boswellia, take it internally, very helpful at modulating inflammation as well. Very good for pain, joints, etc. Next, I would say would be systemic enzymes. So systemic enzymes taken away from food. So if you take enzymes, right, with food, they're going to go to break down the food. So systemic enzymes are taken away from food. They tend to be enterically coated. So they have like a coating on it, usually a cellulose, some kind of a coating that time releases so it can get past the stomach intact, get into the bloodstream, and then ideally make their way into the bloodstream intact, not going to break down food. So you're typically waiting 2 hours after food, ideally on an empty stomach first thing in the morning, wait at least 45 minutes, gets in the bloodstream. Very helpful. These enzymes, these could be serrapeptidase. There's different ones like Wobenzym N, which is a great one that uses a lot of different papain enzymes. Serrapeptidase is a good one. Lumbrokinase, very good. These go in the bloodstream, undigested. They will hit inflammatory compounds like interleukins, like cytokines. They'll also hit scar tissue, which can be very helpful. When you have a lot of scar tissue, again, your body kind of feels like beef jerky. Everything's really tight to move, where it should feel like a nice, subtle, soft, like tenderloin. So we want to have our tissue softer. That's very helpful to reduce tissue inflammation and to improve pliability in the tissue. So systemic enzymes. Okay, so recap: we have fish oil, we have curcumin, we have Boswellia, we have systemic enzymes. Okay, what should we do for our last one? This is a really good one. Let me mull on that for 1 minute. One other thing I would say, looking at the joint side of the fence, that's also super, super helpful is collagen. So people complain about joint inflammation. You want to reduce the inflammation with some of these compounds I mentioned, but also providing more building blocks like collagen amino acids does kind of provide more of that scaffolding to help the tissue you work better. So my line, we have true collagen, which is great. You want one that's grass-fed organic in a peptide form, so it's broken down. Really good, really easy on the gut on that one. Very good. Next one I would say out of the gates would be ginger. Ginger is wonderful. Now, any of my patients listening, I do a ginger tea mixed with some manuka honey and some lime juice. Very helpful for the gut, very soothing, very calming. Love ginger. It's a blood thinner, so it helps thin out the blood. So wonderful for vascular health. It's also an anticoagulant, so it's very helpful when you have die-off reactions. Sometimes things can get kind of sticky in the lymph as well, so it really helps open up the lymph. It also helps reduce blood pressure, I think, via a lot of those mechanisms, thinning the blood out, opening the arteries, natural anti-inflammatory, very good on supporting inflammation in the gut lining. A lot of times we'll combine that with manuka honey as well, because manuka honey is very antibacterial, very soothing. They use it in burn units in hospitals, so very good on that front. So if I kind of recap out of the gates, omega-3s, Boswellia, curcumin, systemic enzymes, and then our last one, ginger. Those are my big five here for today. And again, when you're using these nutrients, always try to say what is going to be the root cause. Make sure you're getting after it. I would say maybe if I were to add one bonus one for y'all, I'm going to give you your money's worth today. I would say white willow bark's really good too. White willow bark is what they make aspirin from, right? Aspirin is an acetyl salicylic acid. So it's very high in salicylate. So if you have salicylate sensitivity, probably avoid it. Some of the kids, there's something called rye syndrome. Careful with that. But if you're doing the whole white willow bark, tends to be a lot better, a lot safer. You have all the antioxidants and nutrients along with it, less gastrointestinal upset. So white willow bark's another good one to take a look at. All right, guys, hope you enjoyed today's video. If you did, give me that thumbs up, put your comments below. Again, if you want to work with someone like myself that dives into the root cause, getting to the root cause of why you have the health issues that you have, there'll be a link down below where you can work with myself and or my colleagues worldwide. We're here to help. Let me dive into some questions that you guys may have. Is it true that lecithin is the antidote to cholesterol? It just depends. It's kind of a loaded question because first off, antidote kind of assumes like something's a poison, right? You take an antidote of poison. So I don't like the assumption that cholesterol is a poison. It's a powerful antioxidant. It's a building block to all of your hormones. Very important for life. Your brain has significant amount of cholesterol. All your hormones are cholesterol based. So I wouldn't say that. Again, lecithin's an emulsifier, so it can help break down fat, maybe help in the digestive process. So I wouldn't say it's an antidote. I think cholesterol is good. It's just, why is your cholesterol high? Are you inflamed? Is your cholesterol high because of trans fats and too much refined sugar? Most of the cholesterol in your body, you make it. And insulin's the biggest driving factor of it. That's why I've seen vegan patients over the years with very high cholesterol. So make sure your cholesterol is not high due to junky omega-6 fatty acids, inflammatory trans fats, and refined sugar and grains. And then if it is high, you got to look at the different ratios, the particle size, got to look at your fasting insulin, got to look at homocysteine, CRP as well, because if you're inflamed, cholesterol can go up from that. What do you think of using low-dose melatonin supplementation long-term at night? I don't like using melatonin long-term personally. I don't like using hormones just long-term like that. I think melatonin's fine to use here and there, coming off a long weekend, you're having a difficult time getting to sleep, you're overly stressed. I think it's fine here and there. I think relying on it every single day long-term, you're much better off leaning on tryptophan and or 5-HTP with B6. I much rather give you the building blocks to help your body make it than give you the hormone that you may rely on. I always get concerned about negative feedback loops that could disrupt your internal production. Again, melatonin, lots of good antioxidant benefits. If you have cancer, there may be some benefits taking that higher dose. If you have like significant low oxygen levels due to some kind of an infection, melatonin's been shown to really help improve oxygen levels up to 10 milligram a day, 10 to 20 milligram a day amount for oxygenation in cancer. But for sleep every day, try to get to the root cause and use more of the building blocks to make it. And if you need it every now and then, not a big deal. And try to stay away from your kids needing it. Again, melatonin is made by the pineal gland. The pineal gland is very important in puberty development. So if you're going to give things to your kids, try to do things like GABA, L-theanine, magnesium, 5-HTP, B6, or maybe some calming, relaxing herbs. Do that over that from a night in, night out basis. A little bit here or there, not a big deal. My doctor had me on 800 milligrams of ibuprofen 3 times a day. That's the max dose. I think 2,400 milligrams of ibuprofen a day is the max. I stopped taking it and used natural remedies, and my pain, inflammation drastically decreased. That's great. I mean, the question is, you were on the ibuprofen for a reason. So just make sure you're asking yourself the question, why did my pain come there in the first place? So look at the food, look at exercise. Don't underestimate the fact that people sometimes can have bad form in the gym, and squats and lunges are done wrong, and that can cause issues too. So make sure you look at your exercise, make sure the form is good. There's lots of good YouTube videos that show good corrective form, so you can at least compare how you look. Topically, yeah, you could easily apply something like some frankincense would be something good you could do. Also, CBD has some really good anti-inflammatory effects. So make sure it's a high quality CBD that's not going to have like the different extract. I think it's benzene or some of the different compounds they use to extract it are kind of chemical-esque. And so you want to make sure it's a really good, high quality organic one. So frankincense would be a good one. And then CBD. Should we be concerned about if our palms turn yellow when taking turmeric? Yeah, so it just depends, right? If your palms are turning yellow, typically it's the carotenoids in whatever antioxidant you're taking is not converting to vitamin A, and it's getting stuck in the palms or in this tissue. So a lot of times when that happens, there could be some low thyroid function. So get your thyroid looked at, number one. And then number two, make sure you're getting like converted vitamin A, not just relying on a lot of the carotenoids. So try to make sure cod liver oil and then good healthy animal products like grass-fed liver or grass-fed beef and or high quality egg yolks, like things that are going to have full active vitamin A in there. Make sure you're getting those so you know the high quality is there. You can pull it out for a little bit, see if it's an issue, but I would just take a look at any other polyphenols that are that color, like orange, peppers, sweet potato, squash. You may want to just cut that out for a little bit, see if that improves, but keep an eye on it. Look at the thyroid too. All right. If you're using white sugar with herbal teas, is it counterproductive? Yeah, I probably wouldn't do it personally. If you need a little bit of sweetness, you're better off doing like some monk drops, tiny bit of stevia, or if you're going to do something that's actual has sugar in it, you're much better off doing like a high quality wild honey in there because there is some propolis and some immune benefits. It is sugar, but there's at least some other benefits in it. Try to stay away from white sugar always if you can. Okay, good. You're welcome on that one. Very cool. Is PAE good to take, and how much take for inflammation, and how much is it safe to take? Yeah, I forget what that stands for. I think it's like phenylethylamine, or something like that. Trying to look at it and see. So when you say you're talking like pea protein, I think it's like phenylethylamine. I think palmitoethylamide. Yeah, I don't have a comment on that. I don't have enough experience on that one. But it probably works down some of those similar pathways, interleukin, cytokines. I'm looking at it right here. Palmitoethylamide. Yeah, this is the one here. Okay. So palmitoethanolamide is a type of fatty acid known for its potential benefits, minor aches and pains. So yeah, it seems like it's going to be an anti-inflammatory fatty acid, probably working down, decreasing the prostaglandin E2 pathway, right? So the prostaglandin E2 is going to go up with more junky omega-6 fatty acids. So it's probably working in a similar way that you would see like an omega-3 fatty acid work. That's what I'm guessing on that. So that's good. Healthy fats are always good to modulate inflammation. Okay, awesome. Hope that helps y'all. All right, guys, if you enjoyed today's video, give me a thumbs up, comments down below. Appreciate it. Share with family and friends. And you guys have a phenomenal weekend. Take care, y'all.